Hi, welcome to another episode of Responding to Your Questions. My name is Dr. Sylvia. I'm a consultant in general practice, and in this segment, I respond to questions that you've sent in my comment section to one of my videos. So this episode, the question is around early pregnancy bleeding, and it says, my wife is bleeding after we had sex. It is starting to become more than spotting, but it's still day 2 today. How can we tell if it's normal bleeding after sex or is it miscarriage? We are worried we will lose the baby. So let's look at a couple of things that are said here. If we go straight to considering whether this lady is pregnant and whether this is a miscarriage, there is really no way we can tell what's going on until you've had tests done, and those could be beta HCG levels to look at the hormones, the level of the hormones, and an early pregnancy scan to see whether there is a fetal heartbeat. So to answer that question, there is really nothing that we can do. There is no way to guess at this or to try and estimate. No, you just need to have the test done. So the important thing, if this lady is pregnant, is to contact her provider, and they should be able to arrange these things for her depending on how many weeks along she is, because usually here in the UK, for example, where I practice, before 6 weeks you wouldn't have a scan. You may have your beta HCG levels checked and then monitored, but it is after 6 weeks that you'll be able to have a scan that will demonstrate the fetal heart and whether or not the pregnancy is continuing. The other point I wanted to make was where they said if it's normal bleeding after sex. Well, I wouldn't accept bleeding after sex as a normal event, and I would always encourage it to be checked out. Yes, there are some reasons that are fairly benign, and for example, somebody has a cervical polyp or an ectropion, but then there could be other reasons that need to be investigated. For example, cancer, where bleeding after sex happens. So it's something that shouldn't be just shaken off lightly. I would encourage you to get that checked. Remember that we're providing these assessments simply based on the information that's been provided in this short comment. There's not much information here. I would really encourage you to speak to your healthcare provider as soon as possible, really, especially if she is pregnant, to find out what is going on. Guys, let me know what you think. If you have any other questions, you can use my email health information service, and if you want one of your questions to be featured in the response to your questions segment, then please post it. You might be lucky.